somebody who actually quite literally wrote the chapter, this thing in the Indian Standards of Care on mental health is Dr. Kavita. And, that's just something that I wanted to kind of also point out, that we now have these standards of care that are coming out. It's very important that even medical professionals know this and know that there is groundwork that is being laid to work this into the curriculum. But, this thing, so just taking that as sort of like the jumping point toward mental health, I wanted to kind of like talk to Dr. Kavita about a little bit about what she wrote about like who owns gender, because I believe that was the crux of her chapter on the Indian Standards of Care. So Dr. Kavita, please.
Thank you, Tia. It's lovely to be questioned by you. I think it just gives me pride to sit here and sort of be here. And I think the other thing that I really want to mention is how I'm feeling, because this is by Curentia, which is by LHMC, and I'm an ex-alumnus. So it's like coming to home ground. And I think that's also what Curentia means, where you derive your strength from. So thank you for inviting me. And to the all-important question of who owns gender, I think when I wrote about it, it was more like a musing. It was more about also my understanding over the years. Gender was not a construct that we thought about in medical college. Nobody talked about gender as a construct in itself till you encounter someone who questions it. You don't actually start thinking about it. And I think that needs to change, and that's why we are all here. So to say two main points in this about who owns gender, I think every sentence that you start with saying, I am, is owned by you. I am a doctor, I am a sister, I am so-and-so, I am. So when I say I am a woman, that's mine. And it should be, ought to be, and is my choice. However, what is the actual process in our country or worldwide, how gender is actually seen or assigned? So the way that it is usually done is how gender is assigned at birth, for example. So when a child is born, the child doesn't have the sort of ability to say, I am boy or girl or this gender or that. So it is the adults around the child who have the responsibility of assigning the gender. Now, what do they have in terms of what gender should be assigned? The only thing they have is really the physical characteristics. So unless there is something going on that makes them go, as a medical professional, you're going to do more like genetic testing, et cetera, what you're going to, and what anyone is going to look at, is the physical external genitalia. And you assign gender. Now, this is not the concept of gender. This is assigning biological sex. However, many people that I meet seem to say gender and biological sex see it as synonymous, that once this is assigned, this is what the gender of the child is going to be. Now, we know that actually the word gender in the English language, otherwise, this is not the concept. It is not equal to biological sex. Once you know that, the second part of the process is, okay, right now, the child or the individual doesn't have yet the kind of identity that they would be able to articulate and claim their gender. So we are going to go with the evidence that the adults are doing. However, as the child is growing up, what's the process in which they arrive at, each one of us arrives at owning our gender? And here, I think it's very important for us to realize who is responsible here. Because oftentimes it's left to the person to take that accountability, to the individual to take that accountability. However, if you actually look at the process, as a child is growing up, they are usually told, there are stories around them, they're usually told you're a boy, you're a girl. They're dressed like that. Again, who's accountable for that? Mostly the adults around them. So here again, if the accountability and the responsibility is with the adults, if a child's growing up and hearing, I'm a boy, yeah, and seeing people around saying, boys do this. So two kinds of stories. Who you are is told to the child. The other is, what does this kind of a gender do? That's the other kind of story. Boys do this, they don't do that. Girls do this, they don't do that. Now, this is a 4-year-old, 6-year-old, 8-year-old for whom the adults around him are the heroes. They know best and they are absorbing. The other thing that you have to understand about mental health and about each one of us is if you actually look at your and feel your own experiences, there is no way a 4-year-old or an 8-year-old knows how the other child is feeling about the same thing. Because felt experiences are not objective, they are subjective. So if you feel that mango is sweet, or if you feel or experience great joy in a song, you cannot for certainty say that somebody else is feeling and experiencing the same thing, because this is a felt experience. It's subjective, it's yours. Now, how will this child know that if this is how a boy feels, everybody else who's a boy is feeling like this? They don't. So they're taking your word as adults for granted and saying this is how a child must feel. The reason I'm explaining this progression is oftentimes I find doctors, adults, parents sometimes saying, he never showed this to us earlier. Something about bad company or something about what they've watched on the net must have caused this. That's not true, because the way your identity is being formed is very complex. And a lot of it, the accountability is on the milieu outside, the stories and the prevalent social discourses and the stereotypes that we grow up in. And when it comes to taking accountability for it, this is the interface that this child will have to face and either oppose or conform to. And this is how slowly, as a child starts experiencing their own gender, they will arrive at, I do feel like this, everybody else who is like this maybe feels like this, I will own this gender. And then there are others who cannot own that gender because the felt experience is so different that they feel something is wrong. Now, if we had a social structure that said, you are not wrong, felt experiences cannot be untrue, we made a social structure that doesn't fit, then it would have been a very different world. Yeah, the dysphoria may have looked very different. The dysphoria may have been in the social structure of how we can accept each person. However, the accountability is laid square on the shoulders of the young person who's not being able to conform. So in our culture as well, this is a very lonesome experience for those who cannot identify or resonate with their internal felt experience of gender and what is being said ought to be in the. So this is how the sort of arriving at own gender. So who owns us and our identities in India? Because we live in joint families and we are very community driven most of the time. Most of our identities are co-owned. This is not true of just gender. It is also true of how fair are you, how your hair should look, how much you're eating and how you should look if you are eating this much, and what you should take as your career and what. So it's beautiful sometimes to be living in a community, but wherever you are not being able to conform, this also means that this can lead to a lot of distress and confrontation and conflict. So I think this part of who owns my identity entirely is very different in India. And it's a joy, but it can also prove to be extremely difficult for someone who's not being able to see. So this brings me to the third point of then, how does one express gender to the entire? So you express it to yourself, that's your internal journey. But how do you interface with the rest of the world when you integrate with them? And this is really not something that anybody ought to do according to anyone else. This is really something that is dependent on a variable number of factors, including temperament. And this is true for all kinds of expression of identity, not just gender. So you may be somebody who loves to dance, as simple as that. Some of you will be on the stage dancing whenever the music plays. And yet there will be some who will be sitting in the audience tapping their feet. Doesn't mean they don't love dancing. That doesn't mean they can't be dancers. This is their expression. And it's very different socially, non-socially, and you may be the absolute best dancer, but do not want to go on that particular stage. Similarly, for gender expression, there is no singular way to express your gender. And for us, anyone to believe that if you are a woman, you ought to look like this, I think that's a little bit of a unfair bit. So I think that's the other part I see very often that we get foxed by. We do not see the gender expression except in the stereotyped way that possibly we have grown up in. So I think I'm going to stop there with this question, Tia, and hand back over to you. But these are the three things that I really think are very important when we talk about who owns our gender.